turn now to another really critical piece of the EV story, and that's how EVs help with air quality and help promote public health across Wisconsin and across the country. I'm really thrilled to have with us Dr. Joel Charles. He's a leader in this space, working right in Wisconsin, and a leader in this area. So really happy to turn things over to Joel.
Thanks, Sue. Hi, everyone, and thank you for having me today. And thank you to everybody for participating in this critical conversation. Thanks, Admiral Blair, for sharing your expertise and perspective with us. As Sue said, I'm a full spectrum family doc. I take care of patients through the entire spectrum of their lives. And I really got into medicine to help people who were struggling. And I'm here this morning because there's only so much I can do from my exam room. I'm here because you are among the people who will help decide whether my patients keep breathing dirty air or can breathe easy and be healthy. I grew up in Green Bay next to two busy roads, a block from a train yard with idling semis, and a light breeze away from the Pulliam coal plant. I have asthma, my siblings have asthma, my dad had a heart attack younger than he should have. It took years of medical education for me to learn what should have been obvious. We were breathing dirty air, and that made us sick. One of the truly surprising things I learned in my medical training is that our work in clinics and hospitals only determines a small fraction of people's health. The rest is determined by whether they have clean air, clean water, enough nutritious food, stable shelter, enough physical activity, and by their genetics. I was shocked to learn that despite decades of progress on air pollution, it is still a leading cause of illness and death in the US. Most of that pollution is from using fossil fuels for energy. So I did something about it. I got together with others and we formed Wisconsin Health Professionals for Climate Action to help Wisconsin transition to a healthier, clean energy future and advocate for equitable solutions to the climate crisis. We're a nonpartisan, nonprofit group of doctors, nurses, and other health professionals around the state committed to helping the healthcare sector clean up its air pollution while saving money and becoming more resilient to extreme weather. We connect with local leaders to help drive local, state, and federal policy toward health. Climate change is here and harming our health now and will only get worse with delayed action. But I'm not here to talk about climate change. I'm here to talk about an issue which, if we get it right, will have immediate, profound, and local health benefits. That is cleaning our air by transitioning from fossil fuels to clean energy. From the moment of conception to their last breath, our patients are made sicker because we get our energy from fossil fuels. Fossil air pollution causes stillbirths, preterm births, delayed cognitive development in children, asthma, heart attacks, cancer, strokes, and dementia. We are all impacted. Previous estimates were that 100,000 Americans die every year from fossil air pollution. Over time, we have learned there's no safe level of small particulate exposure, and improved epidemiologic methods suggest that number is closer to 250,000 deaths each year. That costs America at least $820 billion each year in healthcare costs and decreased worker productivity. That is a truly staggering price to pay. Since the Industrial Revolution, we have paid this terrible price because the concentrated energy provided immense benefit to our society, and because there was generally not much alternative. We can no longer say the latter is true, and so we are no longer bound to pay that price. We now know how to produce electricity that is generally cheaper than with fossil fuels, and to move people and goods using that electricity. We can no longer justify asking people to pay the steep price of poor health which fossil fuels demand. The blueprint for something better is simple. Electrify everything we can, especially transportation, and produce that electricity in state with clean energy. If we do that in Wisconsin, it would save nearly 2,000 lives every year. And near and dear to my heart, that transition could avoid 35,000 asthma attacks in Wisconsin every year. Electrifying transportation is a key foundation on which to build that cleaner future. I shared with you the opportunity presented by shifting away from fossil fuels, both in electricity generation and in transportation, because when we talk about electrification of vehicles, we need to talk about cleaning up the production of the electricity that will power them. But let's shift now to focus on the current opportunities specific to transportation. A lot of progress has been made at decreasing nitrous oxides and particulate pollution from transportation. But the sector is still responsible for 20 to 40,000 American deaths each year. Ultimately, all ground transportation can and should be electrified. While I think it is a mistake to pursue this transition through a zero-sum mindset, the reality is we operate in a world with budget constraints. If you have to choose where to put your initial dollars for transportation electrification, and if you're going for health, you should start with heavy-duty diesel vehicles that are used where people live and work. Heavy-duty diesel vehicles have a much higher rate of both nitrous oxide and especially the more broadly damaging particulate pollution. Decreasing that pollution is technically more difficult with gasoline engines, and so electrification is a much more promising way to eliminate that pollution. The good news is that much of the heavy-duty diesel vehicles operating in population centers have regular, predictable routes well within the range of current EV models available. These school, transit, shipping, and other commercial and public fleets are ideal candidates for electrification. While EVs for these purposes often already have cheaper lifetime costs, there are other logistical and policy barriers slowing their adoption. They're a no-brainer and the best place to start with public policy to drive this transition. In particular, I want to draw your attention to the problem and opportunity of school buses. Every day around Wisconsin, hundreds of thousands of children board buses to take them to school where they are supposed to learn to be healthy, productive members of society. But on that trip, their growing lungs and brains are exposed to unsafe levels of diesel exhaust. Kids breathe at higher rates than adults, making them particularly vulnerable. On their way to school, they are exposed to air pollution that we know delays cognitive development. This was the price we had to pay when we had no alternative. But electric school bus technology is ready for prime time and generally has cheaper lifetime costs. There's really no justification to delay making this transition, and supporting the electrification of Wisconsin school buses should be a top priority. You might be tempted to think that if you don't live in a big city, air pollution doesn't impact your community, but you'd almost certainly be wrong. Similarly, some might live in a city and have seen reports that air pollution is much higher in neighborhoods with more low-income folks and people of color. They might conclude that even if they live in an urban area, this issue doesn't impact their higher income neighborhood. They'd definitely be wrong. It is true that air pollution is greater in urban areas, and it is shamefully true that exposure to air pollution, like most of the health threats in our society, is unfairly distributed. I know. I grew up in one of those neighborhoods. Exposure to that pollution is greatest where work and residencies are located in your highways and your facilities with idling heavy vehicles. But dirty air pollution doesn't obey neighborhood lines or city boundaries. Dirty air spreads on the wind. I would argue that tolerating 30 to 50% higher rates of air pollution in neighborhoods that have more low-income folks and people of color increases everyone's exposure. There's not a community in this state that isn't impacted by air pollution. This is a rural, suburban, and urban problem. While it may be true that the child in Algoma breathes less air pollution, what solace is that when the children in that community are still at risk? The most obvious example of this is in eastern Wisconsin. The American Lung Association gives Sheboygan and Manitowoc counties an F rating for smog. It gives Kewaunee and Door counties a D. This is in part because of air pollution drifting up the Lake Michigan shoreline from urban areas in and around Milwaukee. I know this is a hot button issue for folks in these areas. They are reasonably upset, but in my opinion, the conversation largely misses the most important point. From what I see, mostly folks debate whether these areas should be deemed in attainment of air standard rules by the EPA because a lot of the air pollution is coming from elsewhere. While this would release some limits on economic development, it would do little to actually make the air cleaner for school children in these communities. What would solve the ultimate problem is for leaders in Northeast Wisconsin, Southeast Wisconsin, and Northeast Illinois to work together to eliminate the pollution at its source, primarily by electrifying transportation. While he doesn't represent the areas I just focused on, I want to thank Senator Cowles for his leadership on clean energy and for helping improve the air quality in the community where my parents still live. If we want clean air for the children in Sheboygan, Manitowoc, and Algoma, we need to achieve clean air for the children in North Milwaukee and South Chicago. Dirty air for one causes dirty air for all, and achieving clean air for one requires clean air for all. Some might hear these words and be frustrated that I call the air in these places dirty. They would point to the tremendous progress made in the last 50 years. They are right. We have made profound progress, but the definition of what is acceptable changes according to the alternatives available. And we now have the option of entirely eliminating fossil air pollution in these communities. That should be our standard of cleanliness. To get there, we have to electrify our school buses, our transit, our shipping, our public and commercial fleets of all sorts, and our personal vehicles. And we need all those vehicles running on clean power produced here in Wisconsin. The good news is that if we do that, not only will Wisconsinites be healthier, they'll be wealthier. As a rural family doc, I see the scars produced by the hollowing out of rural America. But I also see the potential for economic regeneration. Producing renewable energy takes land. Rural Wisconsin can realize major investment and economic renewal by producing and selling the clean electricity that urban and suburban Wisconsinites need. The Rocky Mountain Institute estimates that by 2030, the rural revenue from solar and wind will match that of corn, soy, or cattle. And that doesn't count the major expansion of the grid that will be required in an electrified future. The added property tax revenue alone will keep our rural roads maintained and our schools open. The Center on Wisconsin Studies estimates that an electrified economy powered by 100% in-state clean energy would add 160,000 jobs in Wisconsin. Those jobs can help keep rural kids settling in the communities where they grew up. This is a win-win for all of Wisconsin. There's no greater area of mutually aligned interest between rural and urban communities than on the electrification of transportation and the transition to clean energy produced here in Wisconsin. Everyone wants clean air and water, affordable energy and transportation, and good paying jobs. The transition to electrified transportation powered by Wisconsin-produced clean energy can deliver all of those benefits if we get the policy right. I want to leave you with one final thought. At the end of the 19th century, we didn't stop lighting our cities and homes with kerosene because we ran out of petroleum. We electrified lighting because it was better. It's time to do the same with transportation. Electric transportation is simply better than what we've been doing. Fossil-based transportation has been immensely useful to our society, but we have paid a dear price in the health of our loved ones. We don't need to pay that price anymore. So let's move on and build a state that is healthier, wealthier, and more united. Thank you.
Thanks, Joel. Ben Prohaska, Executive Director for the Electrification Coalition. I got to say, I feel like you nailed every possible talking point that we try to share. And so I really appreciate it. And for the crowd listening at home, this is all Joel's or Dr. Charles's words. So really impressive capturing of I think what we try to communicate on a daily basis, but with the added impact of dealing with those most affected on a daily basis by the impacts of the way we drive. So really appreciate the ability to connect it to an individual level. And I think sometimes that's one of the things that's really interesting and unique about transportation electrification is it is localized health benefits, it is climate issues at a human level. And a lot of times when we're working on these issues, we talk about commodities, right? Oil is this commodity. Even electricity in many ways is a commodity that's hard to kind of understand those local impacts. But one of the things when you brought this up that I would love to just quickly ask, and I think we only have time for maybe one or two quick questions. We might need to have you come back for another session in the future and get into more questions.
Absolutely.
But I'm interested in, how do you see those like external costs playing out, right? The idea that because we have this pollution that travels on the wind that you've talked about, right? How does that affect the idea of the cost that the social costs and the direct costs that we face on a daily basis. And, how does that, it's something we can solve through transportation electrification?
Yeah, I mean, this is something we really talk about a lot in public health, which is the idea that externalized cost, you pay $2, $3 for a gallon of gas. What's not reflected in that price is the cost to society. So, you see a lot more data around sort of the cost of carbon, and that's sort of in the context of greenhouse gases. But the more you factor in these sort of immediate health pollutants like particulates and smog, the more you realize that the cost is tremendous. And there's really a push to factor that into our decision making, whether that's sort of at the Public Service Commission level when we're talking about how do we think about the price of electricity and the value to society, or in the cost of gas. For example, some folks thinking about carbon taxes. But for example, those externalized costs, if Wisconsin transitioned to fully electrified economy powered by 100% in-state clean energy, we would save $21 billion a year in health costs and decrease worker productivity. A lot of the most aggressive sort of investment numbers that people are looking at to decarbonize the US economy are like $300 to $400 billion a year sustained over 10 to 15 years. When you look at the health benefits from decreased air pollution alone, we're talking about $700 to $800 billion a year sustained for decades. So even if you put climate change to the side, we all benefit immediately from this. And that immediate part is really important, because when you decrease fossil fuel air pollution in a community, heart attacks go down immediately. Air pollution impacts go down immediately. So we all have something to gain here. And I think making this transition is just a no-brainer.
Well, we need more time, but unfortunately we have to move on. I so appreciate all of the thought and the background that you built into this. I have a 9-year-old. I wish he could be my 9-year-old's doctor. So really appreciate your efforts here. And
yeah, thanks, Ben.
Thanks so much for joining us today.
Yeah, thanks for having me.